I specialize under the Mako robotic system. In addition to just using the robotic Mako system, which has just helped me, I've seen a great improvement in outcomes, precision, reliability, speed of the surgery. We also use a kinetic balancing sensor at the same time, to where we brought it state of the art now, to where I can basically measure the pounds per square inch in every portion of the knee before I technically replace it, just with the trials. So we know exactly at that time that this knee is going to be perfect. When you have a properly balanced knee and good component placement, and all this plays a role in this, you get a more natural feel to the knee. The patient feels more like the knee they had before. Now, as I always warn everybody, I am not God, and I'm not going to give them the knee that they had when they were 16 years old. But we do want something that they're going to be very happy with and very functional. So I specialize in adult reconstruction, where I did my fellowship, and we do the hip replacements through two minimally invasive types, the anterior hip and the superior hip. Now, difference between the two is essentially negligible, just about where you put an incision, and we tailor that to the needs of the patient. There are some instances where one approach would be more beneficial or less risky to the patient, depending on them as a whole. And since the outcomes between the two are essentially equivalent, we can kind of just go either way, whatever's best for them, whatever's best for that day. I really enjoy just helping people get better, especially those who can't get around. Basically, to some aspect, a lot of these people are essentially crippled, cannot get up, and to be able to just help someone improve their life, make them more functional, more mobile, or even if they are still functional but just have pain and can't do the types of things that they really want to do to enjoy life, or to be productive, or to provide for their families, or whatever it may be, that's what drives me.